I'm Karen Sickney with Take 5 Video. Today we're talking about the rapidly approaching drug supply chain security requirements and how companies are learning to exchange master data with their trading partners. Now, first, let me be real. This is a 5-minute video and it's a massive topic. So I'll link to a couple intro materials below if you're not familiar with serialization and DSCSA. A major component in this legislation is the practice of assigning a unique serial number linked to product data to each saleable unit of prescription drug products. Drug manufacturers must share this data with downstream trading partners. They know that it's legitimate as it moves through the supply chain. Now, this may sound easy when you think about the complex web of distributors, 3PLs, and manufacturers all sharing data on millions of products in real time, it's quite a challenge. So at HDA's Traceability webinar series, experts held a discussion on master data exchange, so kind of the good, the bad, and the ugly. At present, the exchange of master data is a manual process. So serialization data is manually pulled from internal systems, spreadsheets are maintained and emailed back and forth to trading partners. So how can this exchange become more automated? Panelists said the answer lies in manufacturers using a common framework to exchange data, EPCIS files, which stand for Electronic Product Code Information Services. EPCIS is a global GS1 standard for creating and sharing visibility event data, both within and across enterprises, so that users gain a shared view. So let's say you're a manufacturer and you want to start sending EPCIS files to your distributors. A happy path or best case scenario for the onboarding process can take 6 weeks with exchanging data, testing, and moving to production. Now, if every distributor needs to onboard with every manufacturer they trade with, you can see why the 2023 deadline feels like it's coming up very quickly. The testing phase is critical because there are challenges such as errors in master data files that cause failures. This includes timestamp issues or missing data. For a manufacturer, it may not necessarily be enough to correct individual files. They may also have to look at why the file failed and if a process change needs to happen to prevent that in the future. So a few tips if you're new to this type of data sharing. Number 1, EPCIS-formatted messages are usually generated through L4 enterprise systems. If you have low volume or low frequency shipments and you don't plan to invest in an L4 system, there are options for generating EPCIS messages. So first, I would check with your IT folks to see if they can extract information and formulate EPCIS files. Otherwise, there are solution providers that will take data in most any form and convert it for you. Number 2, get help ASAP if you need it. The panelists recommended that manufacturers look into conformance testing companies that will help you learn EPCIS or help you be able to test rapidly. That way, when you approach distributors, you're ready to go. Number 3, exception management is critical. So ensure that you have processes. This includes resources, tools, and SOPs in place for exception management. Product can and will pile up at the dock or be quarantined if distributors don't have serialization data to receive it against. So if your distributor finds a data issue, you need to have alerts in place to quickly react to that. Time is really of the essence here. There's not a lot of time left between now and 2023, and there is a lot of onboarding that still needs to happen to ensure regulatory requirements are met and that pharma products continue to move through the supply chain and reach patients. In the full article, there's a lot more detail. You can check that out at the URL on screen. Thanks, and see you next time at Take 5 Video.